I'm diving into the topic of pregnancy after a C-section to find out if there are any real risks involved. Let's see what the experts say. In this video, you'll learn about the considerations and risks of becoming pregnant after having a C-section, as well as important factors to keep in mind. Many women wonder about the safety of pregnancy after a C-section, and rightly so. It's natural to have concerns about whether your body is ready for another pregnancy, especially if you've had a complex delivery in the past. The good news is that many women go on to have healthy pregnancies after a C-section, but it's essential to understand the potential risks involved. One of the primary concerns is whether another C-section will be necessary, and if so, how that might impact your future pregnancies. Another critical factor to consider is the length of time between pregnancies, as this can also influence the risk of complications. Generally speaking, the American College of Obstetricians and Gynecologists recommends waiting at least 18 to 24 months after a C-section before getting pregnant again. This allows your body sufficient time to heal and reduces the risk of uterine rupture or other complications. Additionally, women who have had a C-section may be more likely to experience placenta previa, a condition where the placenta partially or completely covers the cervix, which can cause bleeding and other complications. By understanding these factors, you can take steps to minimize risks and ensure a healthy pregnancy. It's also essential to recognize that every woman's situation is unique, and your healthcare provider will be able to advise you on the best course of action based on your individual health. They may recommend a vaginal birth after cesarean or VBAC, which can be a viable option for some women, but it's crucial to weigh the pros and cons and make an informed decision. Ultimately, it's crucial to prioritize your health and the health of your baby by being aware of these potential risks and taking the necessary precautions. Uterine rupture is one of the most significant complications associated with pregnancy after a C-section. Although it's rare, it's essential to understand the risks and be aware of the symptoms, which can include intense abdominal pain, vaginal bleeding, and rapid heartbeat. If you've had a previous uterine rupture, your healthcare provider may recommend a C-section for any future pregnancies. Placenta previa is another complication that can arise, which I mentioned earlier. In some cases, a condition called placenta accreta may occur, where the placenta grows too deeply into the uterine wall, which can cause massive bleeding during delivery. Although these complications can be alarming, it's essential to remember that they're relatively rare, and many women go on to have healthy pregnancies after a C-section. However, it's crucial to be aware of the risks and take proactive steps to minimize them. To minimize the risk of complications, it's vital to consult with your healthcare provider and discuss your individual health situation. They may recommend additional monitoring, frequent checkups, or specialized care to ensure your safety and the health of your baby. By being proactive and taking these precautions, you can significantly reduce the risk of complications and have a healthy pregnancy. Remember, it's essential to prioritize your health and the health of your baby by being aware of these potential risks and taking the necessary precautions. Don't hesitate to ask questions or express your concerns to your healthcare provider. They're there to support you throughout your pregnancy journey. The key takeaway from this video is that while risks exist, many women go on to have healthy pregnancies after a C-section. By understanding the potential complications, consulting with your healthcare provider, and taking proactive steps to minimize risks, you can have a successful and healthy pregnancy. Thanks for watching, and if you have any thoughts or questions about pregnancy after a C-section, please leave them in the comments below. Don't forget to check out my other videos for more insights on pregnancy and women's health.